Hi, I'm Dr. Lisa Simpson, President and CEO of Academy Health. Welcome to our Future of HSR interview series. As Academy Health celebrates 40 years advancing health services research and health policy, I wanted to build on that history to look forward at how our field is changing and how we might align our work towards higher impact, more equitable research in the future. In this series, I'll be talking with leaders in health services research, in health policy, and innovation to reflect on where we've been and, more importantly, where we're going next. Hi, Troy. Thanks again for joining me for this conversation. So I want to start sort of almost maybe at the beginning, which is early in your career, you were the lead author on, I think, the first report from this major project, the Harvard Medical Practice Study, that was really the first landmark study to document really the prevalence of adverse events. And from there, you've gone on to have an amazing career. And I wonder how your early experiences as a health services researcher translated or were continued through your career and how they affected your career.
Yeah, early in my career, I was involved with something called the Harvard Medical Practice Study, and it was the first effort to understand the number of adverse events and adverse events associated with negligence that occurred in hospitalized patients. And we also linked it up to a large study of malpractice claims because we were trying to understand how the malpractice systems fit with what was happening actually in clinics. But the more importance of the study was in patient safety, and it really gave the sort of push to the patient safety movement. And a big part of health services research is being a member of a research team and being a good member of a research team, and also trying to understand the empirical basis for what you're doing. And I think those two things were really important through the rest of my career.
So as you think about that new sort of landscape of health services researchers, where do you see some of the greatest opportunities for the field to go?
But when I got to CVS, I sort of inherited the analytics group, and it was about 20 people, and they put together some reports on how well our PBM business was doing in terms of covering medications and things like that. I leave there now, there's 1,200 people, about half of them are doctoral level trained in data and analytics, and far more sophisticated type of work that they do than what we were doing, as little as 15 years ago. Now, a lot of those people are imported from a variety of different quantitative fields, but of course, health services research is an important one. And I would say that most of the work that we do there is informed by health services research techniques, things that have been worked out between health policy people and biostatisticians, basically, is what we kind of sort of consider to be the guts of health services research. And we're ready to take in an industry setting like that, we're ready to take in health economics, advanced statistics, artificial intelligence, machine learning, all things that have come out of the academy and been imported into business. So I would consider many of those people to be health services researchers, although they wouldn't be card-carrying health services researchers. They wouldn't be the people who would come to Academy of Medicine meetings. But nonetheless, the importance and the influence of health services researchers is impressively felt.
I want to dig into another area, and that's digital health. We think about the future of health services research in all of its settings. Is that a place to go? What other places need more health services research?
There's a lot of things that come on that look like they might work, but the annals of health services research are filled with interventions that look like they should work and then didn't work. The whole disease management area is a great example of that. So there are some things in digital health where, for instance, in sleep, it's been carefully demonstrated with randomized controlled trials that a digital approach that builds in a cognitive behavioral therapy approach, it works better than medications. The medications for so-called sleepers, medications to help people sleep, are not good medications. So that's a place where we've got a win-win situation. But a lot of the rest of digital health doesn't quite have that same discipline. The question you're asking, Lisa, about the next generation of researchers is an interesting one. I mean, I see in business kind of where we're going quietly, because we don't publish a lot of things that we do, but quietly what we're doing is more advanced techniques using much larger amounts of data from a variety of different sources. And the people, quite frankly, who tend the data are as important, if not more important, than the people who are doing the analytics.
We've talked about where we've been and some of where we're going. What else would you like to see and hope for in the future of health services research for the next 40 years?
I hope that people continue to ask very difficult questions. I think in some ways, health services research has helped pushed along a progressive agenda in the United States by asking the right questions and pursuing the right issues in a way that provides more information for the country so that it can move along in the direction of becoming a place that's more equitable in terms of the availability of healthcare, and a healthcare system that's more fair. So my strong encouragement to health services researchers is that the important questions are also the provocative questions, and the provocative questions are often those which center on the issue of, well, how are we going to, as a country, and how are we going to ask our government to make sure that everyone has reasonable access to healthcare and that access is equitable. But I think that the prescription to continue to do important work and consider fairness, and at the core of what we do, sort of the vulnerability of individual patients, is the important way to look at things.